our data were similar to other data that are out there that have been published, and that is that postmenopausal women that engage in resistance training can undergo moderate increases in their levels of estradiol. Now, this wouldn't necessarily be likely an increase such that it would reverse or attenuate the process of menopause, if you will, but it could be enough of an increase that it could potentially help to alleviate some of the symptoms of menopause that they might be dealing with if they're not on hormone replacement therapy.
Welcome to the Manifested Wellbeing Podcast. I'm Leandro, your well-being and nutrition coach. Today's guest is Dr. Darryn Willoughby, Professor of Exercise Physiology and Nutrition at Baylor University, Texas. Dr. Willoughby, thank you very much for being here today.
Thank you. I appreciate it. I think it's an honor to be here.
Great. We are going to be covering the benefits of resistance training for postmenopausal women. And to start with our interview, could you please talk about your work at the Baylor University?
My research primarily involves the effects of resistance exercise, resistance training, and biochemical and molecular adaptations in skeletal muscle. We're also interested in looking at nutritional intervention, how that plays in as well. Recently we've started being quite interested in looking to see how some of these mechanisms are differentially impacted in us and humans as we age. So we just recently completed a couple of studies in postmenopausal women, and so we've got some other studies slated that we can get started on here in the coming year, looking at in both aging older aging men and women, looking at the effects of resistance exercise, resistance training, and nutritional intervention, looking at different strategies for protein ingestion and how it impacts mechanisms of muscle hypertrophy and also muscle atrophy in skeletal muscle.
Okay, thank you very much. And to start with, to give a context to our conversation, could you please tell us what are estrogens and how are their levels affected as women they age?
They're within the category of estrogens. There are three. There's estradiol, also known as 17-beta estradiol, which is the most prevalent of the three, and is the one that relatively speaking decreases the most during menopause. And then there's estrone and estriol. These are much weaker in terms of the effects that they have on human physiology, but estrone seems to be the one that is highest during menopause, or actually I say post-menopause, even though they all three of the estrogens decrease, and then estriol is very, very low in women. It seems to elevate during pregnancy, but all three collectively are involved in a number of things within women, particularly obviously reproductive function and such. So that's in the premenopause, collectively they play a huge role in that factor. And then of course we know during menopause, as estradiol levels decrease, then obviously that can have a number of impending effects, particularly on bone mineral density and such. So
yeah. Could you just comment, please, when the estradiol levels at average, what age start decreasing?
Oh yeah. So what age does estradiol levels begin to decrease? You start to see in women the the most significant reduction in estradiol levels during the 40s, and then also they start to decrease even more in the early 50s, unless of course there's some women that go into menopause quite early, so this can occur like in the late 30s. But in general, we start to see in most women entering into what's called a premenopausal syndrome, where estradiol levels begin to decrease appreciably during the 40s.
Okay, thank you. Could you comment a little bit, just a short description, what sarcopenia is?
Yeah, sarcopenia is a condition of muscle atrophy, what we consider during aging. So it's considered to be an age-related reduction in muscle mass. In some cases, during more extended sarcopenia, particularly as individuals become much older, then that can also involve kind of what we call muscle wasting, where it's much more than just muscle atrophy, but it also encompasses a loss of muscle tissue as well. But in general, it's age-associated reductions in muscle mass.
Thank you. And what role do sex hormones play in maintaining muscle mass throughout the person's life?
Oh, okay. Well, so I mean, obviously in both men and women, testosterone plays a pretty significant role in helping to increase or at least maintain muscle mass. We know obviously in men, as they go into andropause, where they have reductions in testosterone, which begin to start occurring like in the mid 30s, and then usually by the time a man's in his 50s and his testosterone levels have decreased appreciably, so that he's what we call hypogonadal. But we know that that testosterone is involved in muscle function. It helps to increase muscle mass. It helps to maintain muscle mass as well. But it also helps to do the same thing in women as well. Although women, the levels of testosterone in women are much, much less than men, but nevertheless, testosterone does play an important role in helping to maintain muscle mass in women as well. And then, of course, as women go into into menopause, then their levels of testosterone will begin to drop as well, along with the levels of estradiol. But typically what we see in women, though, is that the levels of testosterone will begin to drop before they actually go into menopause. So this is something many times we'll get an irregular balance, the ratio between testosterone to estradiol in women. But then the other thing is that we know that in women, estradiol plays a very, very important function as well. And then there's studies to show that, with women, as estradiol levels fall during and after menopause, then they end up having issues with osteopenia, osteoporosis, because of the association that estradiol has with bone mineral density. There's also some data to show that, women also will lose muscle strength, muscle function, and to some extent muscle mass as well, with reductions in estradiol also. Estradiol also plays a role as an antioxidant. So in women, there's some data showing that it can help with remediating oxidative stress and some of the confounding factors that are associated with maintaining muscle mass that are associated with oxidative stress as well. So by and large, we see these hormone levels begin to decrease as we age, and so relative to skeletal muscle function, testosterone is related to helping maintain muscle mass in both men and women. And additionally, estradiol levels also seem to be associated with helping to maintain muscle mass in women as well, postmenopausally, because once they go into that period of time, then they start to lose muscle muscle mass and muscle function.
Thank you. Could you please comment on the risks associated with sarcopenia? I'm thinking about how can a loss of muscle mass affect an individual's well-being?
Oh, yeah, that's a good question. So, what we begin to see with reductions in, in hormone levels in both men and women, but, in regards to sarcopenia, is that, if a person loses a significant amount of muscle mass, then that also will correlate with reductions in muscle strength, muscle function as well. So many times what we see is if a person loses enough muscle strength, then their overall ability to carry out their daily routine, daily activities is decreased. And so many times what that means is that now they end up having less independence within their daily life. So that can certainly have an impact, a negative impact on their overall quality of life, because now they're not able to enjoy the same amount of levels of physical activity, or simply just the levels of activity that they go through their activities of daily living. So, that being said, there's also data showing that reductions in muscle strength and mass associated with hormonal decreases can also impair the immune system. So, and so that can also be associated with sarcopenia as well, as it can correlate to a muscle wasting scenario as a person continues to get older and becomes even more frail.
Okay, thank you. Could we move on the conversation on the effects of resistance training on sarcopenia on postmenopausal women? How can resistance training be protective? If you could comment.
Yeah. So, we know, and there's data to show. We've actually published some studies out of my lab showing that that resistance training in the older individuals can be very, very effective in increasing muscle strength and even muscle mass to some extent, depending on depending on the age of the individual. So what we know is that resistance training can actually attenuate or help reverse the effects of sarcopenia, again, by increasing muscle strength and muscle mass. Now there are some studies to show, particularly in much older individuals, that resistance training is effective in increasing muscle strength significantly, but not to the same extent muscle mass. So this would be associated with individuals who are considered to be very frail, or considered to be enter into the area of frailty, so that they've undergone muscle wasting. But the issue here, however, is that particularly when you just mentioned earlier about quality of life, is that if increasing strength and functional capacity can play a greater role in helping to improve the quality of life, independent of increases in muscle mass. So a lot of times what we see in working with older individuals is that using resistance training as a way to help improve muscle strength, muscle function, help to improve quality of life issues. And so that ends up being kind of more of an important concern rather than increasing muscle mass. So, again, it's more about helping individuals to get back to more of an independent living scenario if they were compromised by that from the effects of sarcopenia.
Thank you. And I'm thinking about on the sides of personal training, working with this population, what would be the adequate level of exercise that from one side you have the protective side of resistance training, however on the other side you reduce the risk of injuries due to training as well?
Yeah, that's a very good question. So I mean, obviously, with any age individual, appropriate intensity of resistance training is always important, so that you want to be able to maintain progress while minimizing the risk of injury. But of course, as you mentioned, older individuals are going to find themselves more at risk for injury in regard to resistance training, just due to orthopedic issues, compromise that they have with soft tissue, ligaments, tendons, and such. So, but what the data shows is that resistance training, by and large, is very effective. But it can also be somewhat safe as a countermeasure to help either not so much prevent, but to minimize the effects and the impact of sarcopenia. But there are also some data to show that in some cases that higher intensities of resistance training can be effective and can also be utilized, somewhat safely as well. But I think, at least in my opinion, having worked with older individuals in an exercise resistance training scenario, that at least in the initial stages of working with older individuals, that I personally would be, I would feel more comfortable starting out on a more of a conservative basis, and starting them out on more of a kind of a lower to moderate intensity of resistance training, and seeing how they respond and adapt to training. And if they respond, if they respond favorably and they're able to tolerate that intensity without any negative recourse, then I would begin to start to titrate or increase the intensity up to a point that I felt that they could appropriately handle. So, there's really based on kind of guidelines from the American College of Sports Medicine, and other professional organizations, usually the recommendation is, somewhere perhaps around maybe 50%, 50 to 60% of a person's maximum effort would kind of be considered to be kind of a low to moderately low intensity, and something that should be somewhat appropriate. I personally would have a tendency to agree with that, but like I said, once I continued to work with the individual and I felt like they were responding favorably, then I wouldn't really have any problem in starting to increase the intensity up to a more moderately high. I would probably never have them doing an extremely high intensity resistance exercise program, just from the standpoint that I personally would want to try to err on the side of being at least somewhat conservative in my approach to help minimize injury.
Thank you. It's a very sensible approach. Thinking about resistance training for this specific population and hormonal levels, how does resistance training affect estrogen levels over time?
Okay, so you ask, how does resistance training affect estrogen levels over time?
Yes, for this,
okay,
for the postmenopausal women population.
Okay, yeah. So there's some data to show that postmenopausal women that do resistance training can have and actually we showed this in a study that we just recently had published with 10 weeks of moderate intensity resistance training and postmenopausal women. And our data were similar to other data that are out there that have been published, and that is that postmenopausal women that engage in resistance training can undergo moderate increases in their levels of estradiol. Now, this wouldn't necessarily be likely an increase such that it would reverse or attenuate the process of menopause, if you will. But but it could be enough of an increase that it could potentially help to alleviate some of the symptoms of menopause that they might be dealing with if they're not on hormone replacement therapy.
Okay, thank you. Just to comment, because along with loss of muscle mass, this population, as you pointed out, also suffer of loss of bone density. If you osteoporosis, if you could talk about what the research says about the effect of resistance training on bone density.
Okay, yeah. So we know that both men and women, as we age and we undergo a loss of hormones, testosterone, estrogen, then that can have an impact on bone mineral density. However, what we see that typically seems to be more of a dramatic issue in females, because estradiol is associated with bone resorption. And so as estradiol levels decrease, then the activity in bone cells of osteoclasts become more active. And osteoclasts are involved in degrading, in kind of eating away bone tissue. So that's one of the primary driving mechanisms as to why reductions in estradiol levels following menopause impact bone mineral density. So with resistance training, or what we call axial loading, just a person standing up and moving around back and forth, loading on the axial skeleton, compounded by the effects of gravity. You get compressive forces on the long bones, legs, and for instance the legs and such. And so that process of loading on bone will help to stimulate bone mineral density. So when estrogen levels, for instance, go down, and testosterone levels in men, but particularly when those hormone levels go down, then resistance training can play a role as a helpful countermeasure in continuing to impose these compressive forces or loading forces on the bone to help at least maintain bone mineral density. And so that being said, is that resistance training, and then the other thing is some of the different exercises involved in resistance training, like overhead press work and such, that actually can compressive forces on the upper extremities, on the arms, in addition to lower extremities exercises like leg presses and squats and stuff like that. That those compressive loading forces can all play very, very effective roles in helping to stimulate bone growth, or at the very least help to minimize bone loss. So,
okay, thank you. Now thinking about these women that they are already doing resistance training, what would be other strategies that can help them to have better results in terms of improving body composition? I'm just thinking if these strategies will be different from the general population.
Yeah, okay. Well, probably the first thing that would obviously come to mind would simply just be, these individuals, both men and women, but particularly in regards to, say, women, is being to be extremely mindful of their nutrition and their dietary intake, just to ensure that they're not, that they don't find themselves in a scenario where they're overeating calories so that they're in a caloric surplus over the course of time. Because if that's the case, because sometimes, the reason I mention that is because a lot of times as people age, for instance, their physical activity levels have a tendency to decline, but their caloric intake doesn't. So, now they're not expending as much energy as they once were when they were younger. But over the course of time, as they're aging, they still continue to eat the same amount of calories. So obviously that's going to potentially put them in a caloric surplus. So that's going to have obviously an impending or compounding effect on body composition. In terms of in terms of that, I would think that, I'm not aware of anything that would have a dramatic impact. I mean, in terms of, without perhaps them being able to be given some type of medication or something along that lines. I mean, the other thing is to perhaps, make sure that they have a normal functioning thyroid gland, which most people do. But in some cases, as they get older, they find themselves gaining extra weight, then that's something that they could certainly go have their physician check out, make sure that their thyroid is working properly. Aside from that, it would be, again, just making sure that they're, that nutritionally speaking, that they're taking in a good, healthy amount of, antioxidant containing foods, different vegetables and stuff that can help them minimize oxidative stress, because we know that as we age, oxidative stress is going to increase anyway. So, it would be probably more of an issue of just trying to make sure that their lifestyle is positively conducive to helping to minimize any excess weight gain.
Okay, thank you. We are almost at the end of our interview. If you could comment about the research that you're currently doing, if you could expand a little bit more, what type of research, sample size, and maybe when you think on releasing any results.
Yeah, we just we just recently finished a study where we assessed the effects of an agent that's a compound. It's called PQQ, pyroquinone quinone, which is is found naturally occurring in some food sources and such. But it's been shown in some literature, particularly in some animal data literature, to stimulate mitochondrial biogenesis and improvements in mitochondrial function. So we did a study where we had we had males participate in aerobic exercise program for 6 weeks. And one group was either on a placebo, the other group was taking PQQ every day. And so we were looking to see if this supplement might actually improve mitochondrial function, biogenesis, thereby also improving aerobic oxidative capacity. And so we did, VO2 max testing before and after. We took bloods before and after, muscle biopsies before and after. And so, what we found that the PQQ compound had a moderate improving effect on markers of mitochondrial biogenesis and exercise performance. So, mind you, this is a relatively short time period. It was only 6 weeks. So if we could have increased the time, the time course of training, we might have seen a more robust effect. So that study is currently in review with the journal. That we got the first set of reviews back, and they were very, very, very positive. So that study should end up being published hopefully around the first of the year. Then we recently did a study where we were interested in looking at the herbal compound curcumin, and so it's curcumin, which comes from the turmeric spice. So there's a lot of data that's shown, particularly in cancer model data and with animals, that curcumin can actually minimize the activity of the ubiquitin proteolytic pathway, which in muscle is that pathway that's the one that's significantly involved in muscle proteolysis or degrading intact muscle. And so, so we gave in humans, we had them either as a placebo or curcumin group. We had them do downhill running on a treadmill so that we could purposefully damage the knee extensors and the legs. And then we gave them, and this was after they had been taking either placebo or curcumin for about 10 days. And so we brought them in, as I said, we damaged them. We took blood samples, muscle biopsy samples for the course of several days. And then we looked at various protein indices that suggestive of muscle protein breakdown, and also looking at whether or not curcumin has a protective effect against muscle damage in response to eccentric related exercise. So, and what we did, and so we just finished that not too long ago, so we're just now starting to write up the results and to try to get and to submit the manuscript for review to a journal. But what we found was that curcumin definitely had an impact on minimizing muscle protein breakdown in response to muscle damaging exercise. So we've got that one. We have another study that will start in January, looking at the effects of heavy resistance exercise, where we're standardizing load, and we're going to look at the effects that it has on androgen receptor activity and the mechanisms involved in how the androgen receptor upregulates muscle protein synthesis. So we'll have that study going on. We just also finished a study that we're working on the manuscript right now, where we looked at giving a bolus of carbohydrate right before a bout of resistance exercise to see how it impacts exercise performance. And we did on a leg press machine, we did the number of repetitions to fatigue for 4 different sets. And so it was pretty tough. So anyway, we found from that, and then we did blood draws, muscle biopsies. We measured, muscle glycogen. We did epinephrine levels. We did glucose. We did insulin in the blood. Anyway, what we found was that, kind of interestingly enough, is that carbohydrate supplementation, providing it exogenously, did not have any impact whatsoever on resistance exercise performance under that anaerobic scenario. So anyway, yeah, we've got a lot of stuff going on. So yeah, as usual. So yeah, me, and then I've got a good group of graduate students that I keep busy on a routine basis. So, which that's good. That's why they're here. So.
That's great, and we on our side, we appreciate, and we check and we research, and it's very good that you're doing this work, because it helps us a lot as well. Thank you very much. Dr. Willoughby, just to finish, because there's the tradition in this channel, at the end I ask some rapid fire questions, if you would like to answer.
Yeah, so what questions?
Okay, so the first question is, what is your favorite book?
Oh my. I don't guess I have a favorite book per se. I would say, the books that the books that I read, I don't like sit down and read novels or those types of things.
Yeah.
I would say my favorite book would be a human physiology book.
Okay, great.
I mean, what can I say? I'm a nerd. What can I say? If I'm going to sit down and read a book, I want it to be physiology, cell biology, biochemistry, molecular biology. But I like a human physiology book because it's kind of more, it's a bit more general and comprehensive about how the human body works. So yeah.
Oh, that's great. Thank you. And what is your favorite movie or a documentary or a visual art?
Let's see. That's a good one. I'd say my favorite movie is Remember the Titans.
Remember the Titans. Why is it so great?
Well, number one is I love American football. I played it for many, many, many years, but I love that. But I also love the story. I don't know if you've ever seen the movie or not. It's got Denzel Washington in there, and he's a high school football coach back in the 70s in the state of Virginia. Back before integration, and so he takes over as a head football coach at basically at an all white school, and so he works to well, let me back this up. So he takes over as a head coach at a school that is integrated, and there's a lot of racial tension. So he's a black coach. There's a lot of tension. They're all playing different high schools that are all white. So they're really the only integrated school. So he works, and it's a true story. It's based on a true story. He works to bring all these players and the coaches together to work as one. And so it's very touching how he was able to knock the boundaries of racism down and have everyone come together and cast all that aside, but come together as one and play and unite as one team. And then they succeeded, and it's so anyway, it's very touching, and I like it because it's extremely meaningful as relative to the human condition. And so, yeah.
Thank you.
That's my favorite movie.
That's great. I'll make sure I will check this movie out. What is your favorite hobby or an activity that you enjoy doing?
Weight training.
Great. An inspirational person for you?
My wife, Vicky.
A place you would like to visit?
Australia.
Great. And just to finish, if you could complete this sentence, a meaningful life for me is?
A meaningful life for me is one where I can have a positive impact on the lives of others.
Dr. Willoughby, thank you very much for your time. I appreciate it. Thank you.
Thank you very much. I've enjoyed it, and it's been an honor and a privilege.